Since I was a child, I have always had an interest in animals. Not really the cute and cuddly ones, but the ones that needed extra attention. My mother enjoys telling the story of my first trip to the pet store to pick out a pet bird, and the one I chose was the only one that couldn't fly, and as a result needed extra attention and care. As I grew up, my thoughts, of course, evolved and started looking at not just animals, but their behavior, our relationships with them, food system security, disease transmissibility, and the environment that holds all the above. My interest in public health became a small spark when in 1995 I started working at my first veterinary clinic, and a credentialed veterinary technician told me that I didn't need to wear gloves when I was handling samples, because there were very few diseases animals carried that people can transmit, which I became later to understand was called zoonotic diseases. I thought, really? Considering we were handling blood, fecal matter, urine, and many times animals with unknown health histories, this didn't make much sense to me. Working with pets that were leptospirosis positive, managing sheep with ORF, discussing parasite worm prevention in homes with pregnant women and children, working on surveillance with avian influenza deployment, giving presentations on poultry biosecurity practices have contributed to my belief of the importance of public health, whether it's been during my time working in private practices, at Michigan State University, at a nonprofit veterinary clinic, farm work, and with the United States Department of Agriculture. I can see how determining the health of a community and ways to maintain the welfare of a community are part of every position I've held. Restaurants, swimming at our local beaches, potlucks at our churches, unprecedented pet access to public locations, travel, public perception about disease prevention, and food security systems all factor into public health. Many of our everyday lives are kept safer because of government regulations and interventions, and those in the multitude of sectors that provide information and guidance on living safely. There are many professions that may not use the phrase public health, but provide assistance to a niche or community that aids in preventing, reducing, or eliminating disease. The Center for Disease Control and Prevention was created in the 1940s, when medicine was first coined in the 1960s. In the late 90s, research showed a link between AIDS and a virus strain in chimpanzees called SIV, or simian immunodeficiency virus, bringing to surface the possibility that the virus that was to become AIDS was first transmitted to hunters while field dressing monkeys. And in the last 20 years, correlations have been made between antibiotics we feed livestock and the increase in antibiotic-resistant bugs seen in human populations. Public health evolves as human habits change, new vaccinations and medical treatments or interventions are developed, and communities or niches believe in the efforts to control disease through conviction, action, and finances.
My interests are in One Health, the emergence of zoonotic diseases, and the collaborative effort between human health and veterinary health professionals. As a licensed veterinary technologist, whether in the public, private, or government sectors, I have taken an interest in educating pet and livestock owners on preventing or reducing disease transmission. I would like to take the new gained knowledge I achieved from UNE's MPH program and apply it towards international work on food security.